Have you ever pondered on the pivotal role science plays in medicine? It's a question that may not immediately spring to mind, but when you stop and consider it, you'll realize that the world of healthcare is deeply intertwined with the world of science. Science, in essence, is the systematic study of the structure and behavior of the natural and physical world through observation and experimentation. Medicine, on the other hand, is a field that is dedicated to the treatment and prevention of disease. So how do these two seemingly distinct fields intersect? Well, here's the thing. Science provides the very foundation upon which medicine is built. It's through the rigorous application of the scientific method, hypothesis, experiment, observation, and conclusion, that we've been able to make astounding advancements in healthcare. From developing life-saving vaccines to pioneering surgical techniques, science has been the driving force behind these medical breakthroughs. Think about it. The polio vaccine, for example, wasn't just stumbled upon. It was the result of meticulous scientific research. The same goes for any medical innovation you can think of. Behind every breakthrough, there's a team of scientists diligently applying the scientific method to solve a problem or answer a question. And it's not just about big breakthroughs. Science plays a crucial role in the day-to-day practice of medicine as well. It's science that allows doctors to understand how the human body works, to diagnose diseases, and to determine the best treatment plans. It's science that equips us with the tools and technologies we need to deliver high-quality healthcare. Moreover, the importance of science in medicine extends to medical research. The scientific method is the backbone of all medical research, ensuring that our findings are reliable, valid, and can be replicated. This research then informs clinical practice, leading to improved patient care and outcomes. So you see, science and medicine are not just interconnected, they are inseparable. They work hand in hand, each informing and enhancing the other. Without science, medicine as we know it would be non-existent. To fully appreciate the role of science in medicine, we must journey back to the origins of medical science. Our journey starts in the cradle of civilization, where the ancient Egyptians, Greeks, and Romans laid the groundwork for medical science. They observed the human body, studied the course of diseases, and developed rudimentary treatments. They were the first to understand that health was not a divine gift, but a complex interaction between our bodies and the world around us. In ancient Egypt, for instance, medical knowledge was inscribed on papyrus, providing a glimpse into their understanding of anatomy and diseases. The Greeks, on the other hand, made significant strides in understanding the human body's structure and function. They began to realize that diseases weren't punishments from the gods, but resulted from natural causes that could be studied and understood. Then, as we move into the Middle Ages, medical knowledge expanded. Physicians began to compile medical textbooks, drawing from the wisdom of the ancients, but also adding their own observations and discoveries. Medicine became a distinct field of study, separate from philosophy and religion. In the Islamic Golden Age, scholars translated and preserved Greek and Roman medical texts, adding their own insights. They established the first hospitals and medical schools, setting the stage for the scientific study of medicine. In Europe, during the Renaissance, the human body was studied with renewed interest. Anatomical drawings became more accurate, and autopsies were performed to understand the cause of death. This period marked a shift towards evidence-based medicine, where observations and experiments were used to understand and treat diseases. These early civilizations' efforts laid the foundation for everything we know about medicine today. Their curiosity and determination to understand the human body and diseases set the stage for the scientific revolution and the dawn of modern medicine. These early strides in medical science were just the beginning of a journey that would forever change the course of human health. As the centuries rolled on, medical science continued to evolve at an unprecedented rate. If we were to travel back in time, we would find ourselves in a world where the most basic understanding of diseases was still a mystery. But as the human mind grew more curious and inquisitive, so did the depth of our knowledge. The 17th century marked a turning point in medical history with the discovery of microorganisms. A man named Antony van Leeuwenhoek, peering through his homemade microscope, was the first to observe these tiny animals, as he called them. Little did he know, his discovery would lay the groundwork for the germ theory of disease, fundamentally changing our understanding of illness and infection. Now let's fast forward to the 18th century, a time when smallpox was a deadly threat. It was then that a physician named Edward Jenner observed that milkmaids who had contracted cowpox did not get smallpox. His curiosity led to the development of the first vaccine, saving countless lives and paving the way for future vaccines against diseases like polio, measles, and influenza. In the 19th century, the advent of modern surgical techniques took center stage. Surgeons, once considered no better than butchers, started to gain respect. The discovery of anesthesia made surgeries less painful, while the development of antiseptic techniques by Joseph Lister dramatically reduced post-surgical infections. For the first time, complex surgeries could be performed with a reasonable expectation of patient survival. The 20th century brought with it even more advancements. From the invention of the X-ray machine to the discovery of antibiotics, medical science continued to break barriers and save lives. The mapping of the human genome at the turn of the 21st century was another milestone, opening the door to personalized medicine and targeted therapies. These advancements not only revolutionized medicine, but also significantly increased human lifespan. From a world where life was often cut short by disease, we have moved into an era where many can expect to live into their 80s or beyond. Such is the power of medical science, a testament to human ingenuity and perseverance. Fast forward to the 21st century, medical science is now at the forefront of cutting-edge technology. In our time, medical science has embraced the digital revolution, using advanced technology to diagnose, treat, and prevent diseases in ways we could only dream of in the past. One of the most transformative developments is the use of artificial intelligence, or AI, in medical diagnosis. AI algorithms trained on vast amounts of data can assist doctors in identifying diseases with unprecedented accuracy and speed. From detecting cancers to predicting heart attacks, AI is helping to save lives by catching diseases before they become life-threatening. Yet the marvels of medical science don't stop there. Gene therapy, a technique that involves altering the genes inside your body's cells to treat or prevent disease, is another exciting frontier. By fixing genetic problems at their source, gene therapy holds the promise of curing diseases that were once thought incurable. Hemophilia, a rare disorder in which your blood doesn't clot normally because it lacks sufficient blood clotting proteins, is one of the diseases where gene therapy has shown promising results. We also see the rise of personalized medicine, an approach that tailors treatment to individual patients. By considering a person's genetic makeup, lifestyle, and environment, doctors can prescribe treatments that are more likely to be effective and less likely to cause side effects. This is a significant shift from the one-size-fits-all approach of the past, and it's leading to better patient outcomes and improved quality of life. In the realm of surgery, robots are not the stuff of science fiction anymore. Surgeons are using robotic systems to perform complex procedures with greater precision and control than is possible with conventional techniques. These robotic systems can reduce the risk of complications and speed up recovery times, making surgery safer and more efficient for patients. Today, medical science continues to push the boundaries of what's possible, transforming our approach to health and disease. As we look to the future, we can only imagine what further advancements lie ahead. So, what does the future hold for medical science? It's a question that sparks both curiosity and wonder, isn't it? In the realm of possibility, we find regenerative medicine, a rapidly expanding field that holds the promise for healing damaged tissues and organs, offering solutions and hope for people who have conditions that today are beyond repair. Imagine, instead of transplanting a new heart, we could stimulate the body to repair its own. Sounds like science fiction, right? But it's a future that medical science is actively working towards. Then there's nanotechnology and drug delivery, an exciting frontier that could revolutionize how we treat diseases. Think about tiny, programmable robots, smaller than a grain of sand, coursing through our veins, delivering drugs directly to diseased cells. This could dramatically increase the effectiveness of treatment while reducing side effects. And let's not forget about the potential for curing currently incurable diseases. The human genome has been mapped. We're beginning to understand the role of genetics in disease. And with that knowledge comes the power to potentially cure diseases at their genetic roots. Diseases like Alzheimer's, Parkinson's, and ALS that have confounded medical science for so long may one day be a thing of the past. And what about the role of artificial intelligence? As AI continues to advance, it's likely that we'll see it playing an ever-increasing role in diagnosis, treatment planning, and even in performing surgical procedures. As we look towards the future, one thing is certain: science will continue to be the lifeblood of medicine. It's a future filled with potential, guided by the unwavering curiosity of the human spirit and driven by the relentless pursuit of knowledge. The future of medical science is not just about new technologies and treatments. It's about the potential for a healthier, longer life for all of us. As we look towards the future, one thing is certain: science will continue to be the lifeblood of medicine.